Hello, my name's Stephen Parker. I'm proud to be the chair of the upcoming Middle East Laser Summit, a meeting on the use of lasers in clinical dentistry to be held on the 3 days, 21st, 22nd and 23rd of September 2023. As part of the promotion for this event, we have many invited speakers of world renown and small interviews that give you a flair for the kind of subjects being covered and the kind of extent of learning that may be obtained. Today, it's my pleasure to introduce my close friend and colleague, Dr. Mark Cronshaw, who is in private practice in a clinic in the UK and is also part of the doctoral research team at De Montfort University in the UK. Mark, you will be speaking during the event together with hosting a workshop. Your specialist area of work involves the use of lasers in photobiomodulation. Very briefly, I know it's a massive subject, but perhaps give us a flair for what photobiomodulation means within dentistry.
Well, photobiomodulation is a tool which allows, as a clinician, some control over aspects of dental care which all patients are very conscious of, namely pain, post-operative discomfort, sensitivity, the ability to heal and to repair. And so really photobiomodulation offers something which is able to touch every aspect of your daily clinical practice.
So we can integrate laser photonic energy. Is this in terms of cutting, or is it in terms of low level power levels, or is it a combination of both?
Well, actually, anytime you pick up a surgical laser as a side benefit, you are also seeing some aspects related to what we refer to as photobiomodulation. Photobiomodulation is the absorption of photonic energy, which then produces beneficial changes inside the tissues. And this can be related to minimizing trauma surgically, dealing with infection, as well as altering the tissue response towards a more favorable healing response. Because of the different wavelengths of lasers that we choose to use, we've got a wide range of tools, and used appropriately with good training, then this is something which is a very apt tool to integrate into any aspect of your daily clinical practice.
So a vital tool which has immense range of benefits for every patient, whether they receive surgical intervention, both hard and soft tissue, or whether or not they consult as a primary medical event, whether it be a pain syndrome or whether it be an area of inflammation or swelling. These are enormous benefits that patients will derive. And for many dentists who are unsure of or are new to the use of lasers, you feel that this is something that has changed your entire attitude to how you treat your patients?
Well, as an experienced laser user of many years standing, and also as someone that's become very much involved in the research, I'm aware that this is a very large subject. In clinical dentistry, we deal in the consequences of pain, inflammation, and infection. And in this regard, lasers have got very useful properties, which used in a directive fashion can very much improve the outcome, both clinically for the clinician in order to simplify procedures, as well as to very much enhance the patient journey. So it's win-win. Plus, to boot, it doesn't take a lot of extra time. This is an additional aspect which I feel should be part of every clinician's daily practice. And without doubt, it's something which is proven to be of considerable benefit in many different aspects of care.
As we know, lasers are arranged according to their emission wavelength. And for the average dentist looking at the range of lasers available in clinical dentistry, there are many to choose from. Could you perhaps give us an overview of how these groups of wavelengths can be utilized in terms of their photobiomodulatory effect?
Well, we've got quite a spectrum of wavelengths that we can choose to use, and really, to a degree, the question for the clinician is, which wavelengths do you have available? Because it's like a car, you can drive it, whether it's one which is best suited for one application as opposed to another, because a car's a car. In respect of the different wavelengths, we have shorter wavelengths where you can do soft tissue surgery, as well as using them specifically as a directed tool to start to affect the healing cascade, mitigate pain, and as well as affect outcome post-operatively in relation to inflammation. With the longer wavelengths, and here we're thinking primarily of erbium wavelengths, as well as perhaps CO2 wavelengths. These are primarily surgical tools. And in this regard, you've got superb control, particularly with the erbium lasers, not only over soft tissues, but also with hard tissues as well. So there is a philosophy of care we refer to as the dual wavelength approach, where we're using one wavelength in order to manage the surgical aspects of hard and soft tissue management, and another wavelength in order to preferentially manage the tissue response to the intervention in order to optimize the biological capacity of the tissues to heal, repair, and in controlled circumstances to regenerate.
And this brings us now on to the workshop, which is looking at the way in which photobiomodulation associated with many of these wavelengths can be either used singly with a given wavelength or in combination with other wavelengths in order to optimize the post-treatment period, and also to provide instruction for the clinician as to how to integrate this on a practical basis in their everyday clinical practice.
Absolutely. And we are, as clinicians, very much faced with the daunting task of managing infection, which is increasingly difficult to deal with because of multi-antibiotic resistance, inflammation, where there may be acute inflammation, which is causing pain and swelling after our intervention, which hardly helps us with patient compliance, or there may be chronic inflammation associated with long-standing infection, or the patient's impaired ability to heal and repair. And each of these things poses a considerable difficulty. This is where this type of technology and the philosophy of approach is transformative in clinical dentistry in every aspect of clinical care, whether you're looking at periodontology in respect of eliminating long-standing periodontal infections and assisting healing and repair, surgery, where perhaps you're trying to set the frame for some repair, regeneration associated perhaps with your implants work, or in orthodontics, where you're seeking to reduce the amount of discomfort patients experience as they're being banded up and having brackets placed. And in pediatric care, I mean, namely a part of dentistry this doesn't affect. As for the oral medical aspects in relation to some otherwise very difficult to manage conditions, such as temporomandibular disorders, this is, to my mind, a game changer, because we have then a very powerful tool where you can get patients out of pain in the chair without using any medicines, without any adverse side effects, and that's something which I think is indeed transformative.
Thank you very much. This is a very powerful area of laser-assisted dentistry that I'm sure will be fascinating to the new user, but also complement the existing experienced user as they seek to expand their practice. Mark, thank you very much for your contribution today. We look forward to meeting up with you very soon in September. And to colleagues, we equally extend to you a warm welcome to come and join us in Dubai.
I'm very excited at the opportunity to share with you the product of the research that I've been conducting, the experiences that I've enjoyed in my clinical practice, working with Professor Stephen Parker. I know that we have a feast to offer you. We look forward to seeing you in Dubai.